My name is Xiomara Cabrera. Inglés técnico, teacher de autos mucosos. Talk about is the Indacaterol, GLycopyrronium versus Salmeterol Fluticasome for cooks. Talk about is the concept. The concept COPD is a disease that affects the lungs and the bronchi in the characterized by progressive airway obstruction in panting, wonderful difficulty in breathing, coughing, and vegetation fatigue. Medications such as Indacaterol and GLycopyrronium and the Salmeterol. Fluticasome is the efficient combination for COPD. It is the most commonly used treatment in the panting will have a story for reservation. Talk about is the video.
Understanding chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, or COPD, is a lung disease that makes it difficult to breathe. COPD is a long-term disease that often gets worse over time and is characterized by inflammation and severe limitation of airflow in and out of the lungs. COPD is an umbrella term used to describe a group of breathing conditions, the most common being chronic bronchitis and emphysema. Many people living with COPD may have both emphysema and chronic bronchitis. A few people have both asthma and COPD. Cigarette smoking is the leading cause of COPD. Long-term exposure to secondhand smoke or irritants such as air pollution, dust, or workplace fumes, and biomass exposure such as wood smoke can also contribute to COPD. An uncommon genetic disorder called
Talk about is the application in nursing. 1. Advise the patient to run to mouth with water in the vehicle after using the inhalers and they will prevent the appearance of fungi. 2. Shake the blood and place it with the nothing down. 3. Performing a further expiration. 4. Correctly position the leaf around the multiplying. There are also recommendations to put the fork from the mouth. 5. Coordinate adequately the expiration and manual compression of the inhaler. Perform the push after you have started the expiration. 6. Define the drum apnea to 5 and 10. In some indication that 13. 7. The patient should stand on the seat allow maximum expanding of the sheets. Talk about is the video.
treatment and management of chronic better, stay more active, and slow disease progression. The goals of COPD treatment are to relieve symptoms, slow the progression of disease, improve exercise tolerance, prevent and manage complications such as flare-ups, and improve overall health. Patients should become informed about COPD by speaking with their doctor. Sometimes a referral to a pulmonologist or lung doctor may be required. Patients who are informed about their COPD are likely to have better health outcomes.
Talk about is the advantages and disadvantages. Advantages: decrease hospitalization and the severity of COPD, improves quality of life discipline, reduce relaxation of the bronchial smooth fiber by stimulation of the bronchial smooth muscle by 2 receptors, increase muscularity activity that favor mucus excretion. Disadvantages: it should not be used in the treatment of asthma. The administration of Indacaterol causes paradoxical bronchospasms that can be life-threatening. It is not indicated as a recurrent treatment of the acute episode of bronchitis. There is evidence in infant mortality. Talk about is the video.
FDA in 2000.
When Fluticasome and Salmeterol are combined, they form a prescription drug which is available only under the brand name Advair Discus. This medication is made up of a bronchodilator, Salmeterol, and a corticosteroid, cells around a person's airways to relax, in turn opening them and making breathing easier. Meanwhile, the fluticasone component of this medication is most commonly used in the treatment of asthma. It can also be prescribed to treat bronchitis in people with chronic pulmonary obstructive disease. Picture instructions on the package and rinse your mouth with water after using this medication. The most commonly reported side effects of Advair discus include headaches and upper respiratory infections, but please ask your doctor for a
Talk about is the usual application of Ecuador. Compared with Salmeterol, for example, Indacaterol GLycopyrronium reduces the rate of moderate severe exacerbation with a 17% reduction and prolonged time to the first episode 22% reduction. The safety profiles of the wrong treatments were consistent with the cannot prophylaxis and the incidence of pneumonia was in the with Salmeterol Fluticasome that in the Indacaterol GLycopyrronium 48 versus 32% and substantially significant difference. Talk about is the video.
Are the most common primary risk factor of COPD worldwide. According to global statistics, approximately 210 million people have COPD. By 2030, COPD is predicted to be the fourth leading cause of death worldwide. Epithelial cells lining the airways will respond to smoke inhalation by undergoing cellular changes due to long-term exposure. Over time, chronic irritation and inflammation of the air passages causes small airways disease and parenchymal destruction. Irritation and inflammation of the air passages causes constriction in the bronchi and bronchioles of the lung. In a healthy individual, standing at rest at the foot of a staircase while breathing normally, lung volume is well balanced in terms of IRV.
And finally is conclusion. The FLAN study has clearly demonstrated that Indacaterol GLycopyrronium is superior to the long-acting beta-agonist occurring bronchodilator treatment to reduce exacerbation by proposing an alternative to steroid therapy for optimal treatment of COPD patients. Talk about is the video.
Always rinse your mouth with water, gargle, and spit it out if your inhaler contains an anti-inflammatory. Anti-inflammatory drugs can sometimes cause a sore throat, hoarseness of the voice, or increase these side effects. Also help to decrease these side effects. Check the expiry dates and dose counters on all your inhaler medications or that the inhaler is not 10/2012, for example, means October 2012. All drugs have possible side effects. Change the number of puffs without talking to your doctor first. Most often, you can try a different drug or a different dose of the drug to help eliminate these side effects.
Thank you.